everyone. Thank you for tuning in to this podcast. The topic for today is syphilis, and I have in our panel Marie Brown, Notifiable Disease Director and Epidemiology Lead for District 2, and Sandy Cartwright, Communicable Disease Specialist, District 2, and Alex Niben, our Director for Quality and Pharmacy for NGPG. Thank you for joining me today. So we're just going to have a conversation and really share information with each other and those who will be listening to this podcast about what are our syphilis rates in the community, what are we doing in terms of treatment, education, and we'll start off with some basics. I'll just to start off, syphilis is a sexually transmitted infection, as we all know, and along with treatment, prevention is mainly very, very important. Marie, can you share something about what you do, given your role as the Notifiable Disease Director for District 2 and the Epidemiology Lead?
Thank you, Dr. Minapali. So for District 2, which covers 13 counties in the district, we conduct surveillance and investigation of notifiable majority of them are also infectious diseases within the district. We do investigations around foodborne illnesses, STIs, vaccine-preventable diseases, all notifiable diseases, which are about over 100 plus diseases for the district. It is required by physicians in all of our medical facilities within the district to report these notifiable diseases to public health. So upon receiving these reports, which they're connected to positive labs of patients, we conduct our initial investigation, and we will provide treatment if needed, our health department, or we will provide recommendations, which comes from majority of the time CDC and DPH, recommendations in regards to preventing further spread of these diseases.
Thank you so much for explaining that. That is very, very helpful, and we collaborate a lot with our public health colleagues, given my role in infection prevention and control, and Alex, your role with the quality in the NGPG and safety and pharmacy. And Sandy, can you explain what you do in your role as the communicable disease specialist?
Of course, thank you. So we follow up with patients or notifiable reports that we receive to ensure that they are treated and treated adequately. And we also offer partner services. So, and that kind of helps mitigate the spread. I have to get, individuals to talk to me and tell me about their partners and give me contact information so that I can then confidentially notify everyone that may have been exposed.
We also, as the Notifiable Disease / Epi Department of District 2 Public Health, we do a lot around data collection and analysis. So we look at trends of diseases within a community, and we focus on gathering that information and reporting out to our health partners within the community. And so that information is used to positive impact within our community.
That's very important. We do rely on the health alerts communications we receive from the public health so that we're aware of what is going on in the community, or if there is any notifiable disease that's been identified in the community. So we're on high alert when it comes to patients presenting to any of our facilities. Thank you for sharing that. So when it comes to sexually transmitted infections, as we're focusing on syphilis today, we hear about increasing rates of syphilis in the community, but you have more details about those numbers and where we are currently and how that has changed over the last few years. Can you share more about that?
Definitely. So we've definitely seen an increase in recent years. So 2024 data, where we pulled data from, was from OASIS, which is DPH system. That data at this point, the 2024 data, is still provisional data, but we do have data up to 2023 for District 2, and that covers our 13 counties. In 2023, which was the previous year from 2024, we did see an increase, and that showed a 28.2 per 100,000. Yes. And so looking at that 5-year period, that 5-year trend, from 2019 to 2023, there was a decrease where there was 19.3 per 100,000. So that's just for District 2. So when we look at the data and look at areas that Northeast Georgia, you guys system covers, we look at Hall County. What was striking for us is we did see a lot of some increase in Hall County, NGMC Habersham, NGMC Barrow County, MGMC Braceton, but we saw a decrease in MGMC Lumpkin.
Okay.
So where in 2023, for that year, the rate was 5.7 per 100,000. For the 5-year trend from 2019 to 2023, that was 9.9 per 100,000. So we did see a little bit of decrease in Lumpkin County.
Thank you for sharing that. Does your data also go into details of what stage of syphilis are patients presenting more? Because as we all know, the different stages of syphilis, and Sandy, it will be helpful if you can elaborate on that. Are we seeing more in pregnant patients? Are we seeing more in teenagers? Are we seeing more primary, secondary, any of that information?
So we're always going to see more syphilis of unknown duration because it's the easiest to stage, without symptoms. There has been a significant increase in congenital syphilis for Georgia. I don't have the numbers because I don't know if it specifies, but the most often diagnosed is unknown duration.
Okay. How is that? So if, let's say, we're seeing a patient in our office and they have a positive blood test. They may be presenting with rash, or the blood test was done as part of some other workup, but then they have a positive test. What is the process to refer patients to public health for treatment and for the management?
So patients can access care at any clinic that provides STI testing and treatment. What is unique at District 2 is we provide comprehensive syphilis testing and treatment. So we will do the preliminary testing, RPR, and then we will do confirmatory. And once those results come back and RPR is reactive, confirmatory is positive, we will offer treatment. We will do appropriate staging before treatment, and then we'll offer treatment. And then we push the envelope a little further by offering partner services, like what Sandy talked about earlier. So we will contact partners of patients who test positive, and we will offer testing and treatment for them also.
Thank you. And what's the process, Alex? Let's say if a patient is seen in NGPG, do we need to send a referral, or can the patients just present themselves? I think that's a question actually to both Alex and you guys.
I think we've been working with our partners at DPH to fine-tune the process. Patients can be treated in-house within Northeast Georgia Physicians Group, or they can be referred over to the Department of Public Health. We are working on our ability to streamline the process, but a patient can walk over and use their services without even taking their labs, because they offer such a great service to be that full service treatment for syphilis. And I love hearing about notifying the partners. That's amazing.
Yeah. And so all patients have to do is, majority of our patients that we see, they're self-referred. So they only have to call the nearest health department within that county that they live in, and they will be offered the soonest available appointment that is on the schedule. We do have a process for providers who are looking to expedite care for their patients. So we encourage them to reach out directly to the health department and ask to speak to a nurse manager, and that nurse manager will expedite services for that particular patient.
Wow. That'll be very helpful. Maybe as part of the podcast, we can share the link. We can share that information also. That way it's all in one place for those tuning in to listen to this information. So I think it's important to know that patients can self-refer. And also, of course, a provider can try to expedite the referral process by reaching out to the nurse manager. I think that's very helpful to know. When patients are referred, what do you guys need from the referring doctor? Do you need the copy of the blood work? What is the information that is needed for
Yes,
your team?
all of it.
Okay.
We do. We want to know if they were tested, what all they were tested for. Otherwise, we're going to repeat those labs, which isn't always necessary if you guys have already done the testing. So just all of their labs, even the ones that are non-reactive, so that we know.
And for syphilis, since syphilis is a little different from other STIs, it helps us to understand the full picture. So if a patient tested negative in the last 6 months, we know it's been about 6 months since they've been exposed to the disease. And so that puts us in a place where treatment looks different from whether to give bicillin one shot or whether to do big times 3.
Yes.
So
that's very important. Yes. So I think any information, whether it's a earlier test that was negative, that gives you the timeline, and of course the most recent lab work. And given syphilis is a sexually transmitted infection, there's some other infections also that could be transmitted along with syphilis. So what would be your recommendation, whether it is at your office or whether it is any of the primary care offices, if they are suspecting a sexually transmitted infection? What should be part of the basic workup along with, even if they're presenting as possibly having syphilis, what other tests should be done?
So it's always great to know the exposure sites because and offer the 3-site testing, multi-site testing, extragenital as well as genital and urine, depending on, again, exposure sites. So it's for chlamydia and gonorrhea. I don't know if I said that.
Yes.
And then let's see. So not everybody does the same algorithm. Some people do RPR first, some people do the confirmatory first, and then it cascades. We always want that confirmatory if the RPR is reactive, and then we need the titer as well.
Yes. What about HIV testing? Is it done in all of them who are presenting with a diagnosis?
We offer to, if depending on the patient in the diagnostic evaluation. Yes.
And the consent is needed for HIV testing in Georgia. That's correct. Yeah. What about the other STI testing? Is that also a
consent is needed for any testing? And so some of them they're going to collect themselves the specimen, so they have to be on board with that.
Yes.
But testing for other STIs, it's part of the usual process, part of the usual diagnostic evaluation that is done within the health department. So a patient may come in and let us know that they're exposed for one thing, give an example for syphilis, but as part of that full workup, we will do a full diagnostic evaluation and test for other STIs.
Something that we have that's unique is a rapid syphilis test. So it can determine, so we can start treatment that day if the rapid is reactive. It's 15 minutes or less.
Wow, that's very helpful to know. Yes.
Yeah, a treponema.
It's good, like a confirmatory test. It won't give us obviously an RPR, but
Okay.
So results come back in 15 minutes.
That is very good to know that you have the rapid test available at the public health department. So when the patients come, they get the test and then they wait for the results, and then they can probably get treated if we can stage them also. If they don't need any further workup, like some patients may need further workup to really stage, especially if you're suspecting any nervous system involvement or any other internal organ involvement.
And I think that's what when I talk about staging, the rapid treponema test it's a confirmatory test that will let us know the presence of syphilis, but it wouldn't be able to distinguish whether it's a new infection or if it's an old infection. And that's where more testing or getting more information from the patient will be really useful.
That's very helpful to know. And when it comes to our patients, Alex, when we are seeing our patients in our offices, again, the standard practice is we look to see if they have any other STIs. And of course, you made a very good point. We have to actually test all the potential sites of transmission. Otherwise, we can miss the infection, especially the chlamydia and the gonorrhea. And also something else is that HIV is also offered the testing and done with the patient's consent. And when it comes to pregnant patients, you mentioned about congenital syphilis, and that is a big concern because congenital syphilis can present in so many different ways and involve the baby or the pregnant mom, can result in stillbirth, low birth weight, infants, can affect the bones, the heart, the nervous system. So it's extremely important that we are identifying and treating our pregnant patients so they don't transmit it to the babies. What is the recommendation? I know they get tested at the first prenatal visit. And do we repeat the test again?
At the third trimester, and then again at birth.
Okay.
Yes.
That's very helpful.
And those are some of the cases that when I talk about expediting our
Yes,
cases,
definitely.
those are our sensitive
Yes.
cases that we expedite within our health department. It's really crucial that we're identifying what is going on, and we're treating our pregnant patients before they're no more than 30 days into that delivery date. Is very crucial for us to be able to provide treatment to them as soon as possible. Going back to our syphilis rates and looking at that age group that's affected the most. So when we look at the data, we were seeing from 2019 to 2023, we saw that our younger workforce between 25 to 44 years old, they were affected the most with about 463 cases from that time frame, which puts, for looking at rates, it put it at 50.4 per 100,000 within our district. If you look at the congenital cases and you see that childbearing age, that puts us right within that childbearing age. So when we look at that, we know how crucial it is for us to focus on that individual.
That's a very, very important point, and very important because we do not only do we want to decrease overall syphilis rates, but also really prevent the transmission to the babies. Alex, when it comes to treatment, do we offer Bicillin at NGPG offices?
Yes, we do have access to Bicillin. It requires notification to one of the pharmacists that works with NGPG, and then we coordinate with the hospital to have the doses shipped based off what the patient needs, based off their staging, how many doses get sent over there, because we want to send the full course of treatment. And then we also work with our pre-cert team to make sure that we know exactly what it's going to cost the patient, and then if there's a cost barrier, we try to get that answered same day so we can get them coordinated over to the Department of Public Health.
So the option could be, if we have availability of the drug and there is no shortage, we can treat it through the NGPG offices if patient is seen in one of 4 offices. Of course, there's the other option of referring to our public health. And because we do run into this from time to time about shortage of getting access to the drug. And that's when we really, really rely on our public health partners to help us. While there are alternatives like ceftriaxone, doxycycline, a question that comes up is, are they as effective as Bicillin?
They are as effective. It's the adherence to taking the medication twice a day. That's the part that falls short often.
Yes, that's a great point you make.
Or 14 days or
28 days.
That you make a great point about that. I think having access to that shot, whether it's a one time for primary and secondary or early latent or 3 times every week for the late latent, I think if we have access to the Bicillin, that would be our drug of choice. We also collaborated on what to do if they have penicillin allergy, true penicillin allergy, and they're pregnant. That comes up.
Yes.
Desensitization.
Yes.
We have to refer them.
That's the next step, and they will be referred out to do the desensitization. And once they complete that process, then they can continue treatment.
Yes. No, and thank you for the collaboration. We did work on the order set for desensitization in collaboration with our OBs or critical care doctors, because if we're going to do desensitization, we'll be doing that in an ICU setting with close monitoring. And also from an OB standpoint, the recommendation is that they're also on the fetal monitor, because sometimes the treatment itself can release that spirochetal load, increase that, leading to Jarisch-Herxheimer, I'm probably not spelling it right, reaction. So monitoring the baby very closely. So we really worked on that process as well. When it comes to neurosyphilis or syphilis involving the eye or the ears, those patients need IV. And the treatment is 10 to 14 days, and they need a lumbar puncture. When you see patients in the office, how do you approach that? Are they sent to the ED, or do you can get LP as outpatient?
When we need the LP done, we will send them to the nearest emergency departments. We also have an I'm not going to say this right, ophthalmologist that we refer patients to if there's ocular, involved. But yeah, we make, and we always, our district health director is very thorough in referring patients to get checked out for neuro, just to rule it out.
Yes. I think that's something, if you don't suspect, you can easily miss, given how it can mimic so many different things. The patients can present with stroke, sometimes with the otic syphilis, hearing loss, ringing in the ears, or some vertigo. With the eye changes, it could be, again, blurry vision, or, different types of involvement in the eye as well. When it comes to follow-up of patients who have been diagnosed, and I think that's a question to all the panel members. What's the process for following up after treatment?
We want to make sure that they've completed their treatment, depending on what what stage they were. And when doing partner services, I try to do a re-interview just to see if, maybe they forgot about someone or missed somebody, or if they promised to give me contact information. I want to follow up on that commitment.
And so we also follow through with
6 months and 12 months.
So we do follow-up testing.
Okay.
So we, at that last treatment appointment, we recommend testing in 6 months and then 12 months. So we do offer that to our patients that we treat within our health department.
And I think that gets missed a lot, that follow-up titer. We need that to see if treatment was effective and to, to know if going forward if they get reinfected.
I think that's very important aspect of the follow-up after the treatment. Can you elaborate more on the counseling that is provided when patients come in for testing, whether they test positive or negative, but definitely if they test positive,
right?
For any STIs, what type of counseling, support system, or resources they're provided with?
We have free mail order condoms if they would prefer, and we always have them in all of our health departments at no charge. We do risk reduction counseling and ask all kinds of questions about substance use and things that may affect their risk factor.
We also collaborate with the closest Ryan White program for our HIV patients. So that program currently is under District 1-2, but majority of our patients are connected to that clinic. So when we do have HIV, like confirmatory results come in, our HIV patients are referred to our HIV prevention coordinator, linkage to care coordinator. And so they are able to get linked to medication management. I also know that program can provide other services like dental care and other care for HIV patients.
Housing, can help transportation to get to and from appointments.
And that program is called the Living Bridge. It's the Living Bridge that's located here in Gainesville.
So that's very helpful. Are there standard algorithms your team uses? Because the reason I'm asking is maybe it'll be helpful for us to share with our NJPG colleagues, not necessarily about the treatment, I think, but really the follow-up aspect. And for the counseling that's provided, if there are any resources that your team uses, that'll be very helpful. So maybe we can talk after this and just, see how we can collaborate more. How have these drug shortages affected you guys, or you have access to the medication through?
We do currently have access. There's not a shortage right now, but of course there was last year, and at that time we were prioritizing, pregnant cases for Bicillin.
Yes.
Yeah.
Because that's one population you cannot use the alternatives.
We can't, right.
Yes, yes. So I think that's very important. Syphilis is a reportable or notifiable disease. So is that something you get that information? Because a question I get from the providers is, do I have to call? Do they have to call, or do you work directly with the labs?
So, syphilis is definitely a notifiable disease, and there are many ways that syphilis, along with other diseases, can be reported to public health. It is mandated by law for any requesting physician, a lab, or facility to report labs coming in for these diseases, and there are multiple ways to do so. So for diseases that need to be reported immediately, which syphilis is on that priority list, we would prefer a call-in. So that information is on DPH website under notifiable disease reporting. Every district, all 18 health districts within Georgia, there's a contact information that is listed. And once that physician or that lab make that initial call, we will be able to request labs or have labs fax in. For diseases being reported in 7 days, that can go through our electronic system, the SEND system, the reporting system, and also fax into that local district that is connected to that patient. We also can receive reports through the mail, but that takes longer than 7 days, and mainly for other diseases like cancer or brain disease, those diseases. Another way to report, physicians and labs can call 1-866 Pub Health. That sends them to their triage phone line, where they will be able to speak to a medical epidemiologist at state level. A lot of what we see go through that line is our priority diseases, as in measles, and for syphilis STIs that needs to be reported immediately, will also go through that line.
That's very helpful to know. And this number that you provided, can that also be used to contact public health after hours for any of the information that's needed?
Definitely. So they're open 24 hours. We also, on the local level with District 2 Public Health and all other public health districts, we do have the Epi On Call that it's active after hours. Usual work time is 8 a.m. to 5 p.m. So after 5 p.m., there will always be an Epi On Call. And also over the weekend, there's always an Epi On Call to take notifiable disease reports coming in.
That's very helpful. And the clinics are usually open during the weekdays?
They are. Clinic hours are typically Monday, Wednesday, and Thursday from 8 a.m. to 5 p.m.
Okay.
Tuesday from 8 a.m. to 7 p.m. And this is when we have a lot of our STI patients coming in, because now they can access care, at a time that works best for them. And Friday from 8 a.m. to 12 noon. Daily, all of our health departments are closed from 12:30 to 1 p.m. And this information can also be found on our website.
That's very helpful. Alex, for our providers who work in NGPG, when it comes to this notifiable diseases, the quality team helps report based on the labs, or they don't have to call anyone?
So we do the SENS reporting that comes in from the positive labs, but the provider is still required to call in the ones that are the immediate notification.
Thank you for clarifying that. And for patients who are referred to our public health clinic for treatment, I know we have a group working on kind of, clarifying or closing that loop about how the patient was treated, whether the patient showed up and received the treatment. That way, the referring provider has that information. Anything you want to share, Marie or Sandy, about that aspect?
Definitely. So we've been discussing this with our nursing team within our health department. And recently we were able to create a form, a document that our providers out there, they can use that form to refer their patients to our health department for treatment. What is on that form is we're asking for patients' demographics. We're asking for testing that was done in regards to syphilis. We want to see whether the preliminary testing pre-hour was done, whether confirmatory was done, and then titer. We also want to know what that titer is. So all that is on that form. And we also ask that labs are attached to that form. So when that patient comes in and receives treatment, what we can do with that form is there's a section on that form that we can input our care plan. What was done with that patient in regards to further testing and treatment. And we provide recommendation what is needed, whether that patient will need to come back in the next 6 months to get further testing.
And then you'll send that back to the referring provider's office.
Yes. So we have a staff that comes from our communicable disease specialist team. Since they're doing the STI prevention, like case management part of the work, while our nurses are within the health department doing the clinical services, providing clinical services, we'll have our communicable disease specialists ensure that that information is getting back to the provider, which is much needed for especially our OBGYN.
Yes, very much for the babies, newborns, and OB. Thank you so much. Do you have any other questions, Alex, related to the process for referral or the communication back? Or
I'm just excited to be partnering with you guys on this and making it better for our patients. We're truly looking forward to that.
Yes, no, same. Yes, thank you so much for all you do. One question, really the nuance of partner notification, because there's also the patient confidentiality. How do you and your team approach that aspect? Because it's very important that the partner is tested, treated if positive,
Right.
and counseled.
It is. Confidentiality is of utmost importance. We don't want to dissuade people from giving us their partner's information. But I assure everybody that none of their information, the person who tested positive, will be shared. And what I do is I basically call someone. I'm like, hey, you may have been exposed. Would you like to come in for testing?
Sure.
That's basically
it.
That's what it is. We are District 2 Public Health. We're offering STI testing. We think you may have been exposed. Do you want to come in? And we always make that clear to our patients. We let them know the information that you're providing to us is confidential. In no way will we be sharing that information with any other person outside of your care.
I think that is very important, very helpful to know. I think we touched on so many different aspects of a way to seek care, how patients get treated, the counseling, the prevention aspect, especially when patients with syphilis have the source, the ulcerations, that could increase the risk of HIV transmission because that can serve as a portal of entry for HIV. Yes. Very, very important that it's recognized and treated early on so it doesn't progress, because sometimes syphilis can present decades later, the tertiary form of the syphilis involving the internal organs. So treatment is so important. Again, treating and testing the partner is very important, and prevention using condoms. And again, prevention is the most important aspect of this as well. Any last words from any of the panel members?
I just think it's important for people to get, it always starts at testing. And not everybody knows that they need to get a syphilis test, but everybody who's sexually active should be tested for all STIs. Testing is prevention.
Yes.
In and of itself.
Very important.
That's where it starts. So,
how often should someone be tested?
If every time they have a new partner, or if they're in a relationship, every year, at the minimum.
Yes.
Thank you. Marie, any last words from you?
I think, just to reiterate what Sandy said, testing is key. It is prevention. That's where everything started. And once you're sexually active, it's important to know exactly what's going on with you. The services are available. In every county that we serve, there's a health department, and residents are only a call away. So call your local health department, call your hospitals in the area. If you are sexually active, get tested, and if you're positive, seek treatment.
Yes.
Because not every symptom is intrusive, especially like syphilis.
Yes.
They'll go away by themselves without treatment.
Yes, definitely. Very, very important. Yes. Alex, any last words?
Use your resources wisely. Test your patients, partner with public health, and take care of our patients first.
Great. Again, thank you so much. It's such an important topic, and thank you for sharing your information. Thank you for joining us.
Thank you for having us.